Halitosis is called as bad breath. So when a patient is having bad breath, they will be feeling very uncomfortable with their friends or partners or where they're working in any office and things like that. So mainly the front office workers and even the doctors, so many people will be having difficulty in facing people because they think that they have halitosis. That is others called as oral malodor or bad breath. So bad breath, it can be detrimental to one's self-image and confidence, causing social, emotional, and psychological anxiety. Breath malodor may be an important factor in social communication because so many people will be talking to each other. So they will be having that psychological feeling also that they have bad breath, and either one or the other, it creates problems in leading a social and personal isolation. They think that their friends are avoiding them, things like that. Breath odor can be defined as a subjective perception after smelling someone's breath. It can be pleasant, unpleasant, or disturbing. ഒരാളുടെ സ്മെല്ല് നോക്കുകയാണെങ്കിൽ നല്ലതായിരിക്കാം, പൊട്ടയായിരിക്കാം, പൊട്ടമണമായിരിക്കും. It's otherwise called as breath malodor, halitosis, or bad breath. These are the terms described, and the term was first introduced by Listerine Company in 1921. They are the pioneers in so many oral healthcare products. And the word halitosis, it's a combination of Latin word that is halitus meaning breath, and the Greek word ending osis, usually describe cirrhosis of liver and medical diseases, cirrhosis of liver cancer. So recognition of oral malodor often begins with the complaint of the subject who either believes that he or she has bad breath or had been told by another individual, their friends, or that you have bad breath, and they have the psychological feeling that people are avoiding me, or when they come, the people, the friends know that oh, she is coming or she is coming, so they'll try to avoid them. The psychological trauma is little more. In the classification of halitosis, classification mainly of two types. One is genuine halitosis and pseudo halitosis. Genuine halitosis is where the breath malodor is a real problem and can be easily diagnosed either by organoleptic, that is that you take the saliva in a wooden stick, or you ask the patient to spit in a glass, let it dry and you smell it. That is organoleptic method. Or by physicochemical method, that means you use some chemical agents, then you diagnose halitosis. And pseudohalitosis, where the malodor does not exist, but the patient believes that he or she has malodor, that is a pseudohalitosis. And if after successful treatment of either genuine halitosis or pseudohalitosis, if the patient still feels that they have halitosis, it is called as halitophobia. That's like it's a phobia that whatever treatment has been done, they still has it. And genuine halitosis is further subdivided into two, that is physiological halitosis and pathologic halitosis. Physiologic halitosis means it's a transient halitosis, like early morning you get up, you feel bad smell from your mouth, mainly because of the mainly seen from the tongue coatings, that papilla or those dried up and things like that, the dead tissue, papilla. So it creates, once you remove that, you brush your teeth, you clean your tongue, that smell is gone. It's others called as morning breath. It's merely a cosmetic problem than anything else. So physiologic halitosis, it's nothing but transient halitosis. It's only for some time. You wash your mouth, you clean your mouth, you brush your teeth, that halitosis is gone. In pathologic halitosis, this is permanent and does not resolve by usual oral hygiene methods and prevent the patient from carrying out a normal life. The pathological halitosis should be treated, and its therapeutic approach depend on the source of the malodor. It has to be treated because some underlying pathology is there. It can be either ear, nose, throat problem, digestive problem, respiratory tract, or gastrointestinal problem. Anything can cause a pathologic halitosis. And depending on its origin, pathological halitosis has been subdivided into oral and extraoral. Oral, you know that the pathology condition in the oral cavity or the dorsum of the tongue, and extraoral, the origin of the outside the mouth, that could be upper respiratory tract, your ear, nose, throat, or digestive system, or systemic conditions, or systemic disorders, and things like that. And factors affecting it involved in the etiology of halitosis. That unpleasant smell of breath mainly originates from volatile sulfur compounds. These volatile sulfur compounds create halitosis, mainly hydrogen sulfide, methyl mercaptan, and dimethyl sulfide. These three chemicals, after disintegrating, causes this the volatile sulfur compound, this producing the bad breath. Other compounds in the mouth air may also be offensive, such as diamines, example, putrescine or cadaverine, indole, scatol, mainly seen in our stools, and butyric and propionic acid. And the list of volatile compounds produced by the saliva or tongue coatings, it is mainly sulfur compounds, short chain fatty acids such as propionic, butyric, valine acid, polyamines, that is cadaverine, putrescine, alcohol, 1-propositool propanol. Phenyl compound, that is indole, scatol, pyridine, alkaline, 2-methoxy propane, ketones, and nitrogen containing compounds such as urea and ammonia. The volatile sulfur compounds result from the proteolytic degradation of the oral microorganisms of peptides present in the saliva, in the shed epithelium, food debris, GCF, and interdental plaque, and post-nasal drip and blood. The most malodorous compounds express themselves only when they are volatile. Mainly compounds down the proteolytic degradation of the oral microorganisms, the peptides present in the saliva or the epithelium, the tongue epithelium, the food debris present or the GCF. The intraoral causes, so many intraoral causes are there. One is a dentition, deep caries lesion with food impaction and putrefaction. The food get impacted between the two. It resides there for 1 or 2 days. It putrefaction. Putrefaction means it started disintegrating. So bad pressure, extraction wound filled with blood clot, purulent discharge from the interdental food impaction, acrylic dentures kept in the mouth at the night and not regularly cleaned. These all causes halitosis. And periodontal infection, the gram-negative bacteria associated with gingivitis and periodontitis, mainly the Porphyromonas gingivalis and Actinobacillus aggregatibacter, Actinomycetum comitans. Previously it was called as Actinobacillus Actinomycetum comitans. Now it is called as aggregatibacter as Actinomycetum comitans and Provotella intermedia. These three bacteria mainly produce volatile sulfur compound. The amount of volatile sulfur compounds in breath increases with the number, depth, and bleeding tendency of the periodontal pocket. The deeper the pocket, there will be chances of more anaerobic bacteria to grow. So deeper the pocket, the bad breath also increases. This volatile sulfur compound aggravates the periodontitis process. They increase the permeability of the pocket and mucosal epithelium and therefore expose the underlying connective tissues of the periodontium to bacterial metabolism. Third cause is dry mouth. Patients with xerostomia present large amounts of plaque on teeth, processes, and dorsum of the tongue. The increased microbial load and the escape of volatile sulfur compounds as gases when the saliva is drying up leads to halitosis. Xerostomia means reduction in saliva or very less saliva and patient having dryness of the mouth. That's condition is called as xerostomia. It can be due to any blockage of the glands, salivary glands, or can be due to some cancer or things like that. So many other things causes dry mouth. Even diabetic patients, some patients complains of dry mouth. And the fourth cause is the tongue and tongue coatings. This is one of the main factor which causes oral halitosis, and one of the main reason is the tongue and tongue coating. Many studies implicate that the tongue is a primary source of oral malodor. The larger surface of area of the tongue can harbor higher numbers of bacteria because the tongue is very wide and it has a larger surface area, even the upper portion and lower portion, and it's a bit rough in nature. So chances of food gets stuck in within the tongue is more, and even the epithelium. The innumerable depressions in the tongue surface area are ideal niches for bacterial adhesion and growth and sheltered from cleaning actions. The desquamated cells, food remnants, remain trapped in the retention site, then putrefied by the bacteria and forms a coating on the dorsum of the tongue, giving rise to oral malodor. നമ്മളിപ്പോൾ കഴിക്കുന്ന ഭക്ഷണം എല്ലാം പറ്റി പിടിച്ചിരിക്കും, അത് ടങ്ങിന്റെ പല ഭാഗത്തിരിക്കും, അത് കുറേ ദിവസം അല്ലെങ്കിൽ കുറേ നേരം ഇരിക്കുമ്പോൾ putrefaction process starts. The bacteria forms a vertical on the dorsum of the tongue. These are the main intraoral causes. Now we are going for the extraoral causes. What are extraoral causes? Mainly the ENT causes, ear, nose, throat. It includes acute pharyngitis, either viral or bacterial pharyngitis, purulent sinusitis, purulent tonsillitis, or postnasal drip. These are the main causes for ENT-based or ear, nose, throat associated halitosis. Postnasal drip is associated with chronic sinusitis or regurgitation esophagitis, in which the acidic content of the stomach reaches the nasopharynx and causes mucositis. This is perceived by patients as a liquid flow in the throat, originating in the nasal cavity, causing a very strong breath malodor. And second is the one in the extraoral cause is the bronchi and lungs. The pulmonary causes include chronic bronchitis, bronchiectasis, and bronchial carcinoma. This any like pulmonary causes, is you are having chronic bronchitis, that regurgitation, the smell comes from the oral cavity, and it shows the patient will be having discomfort, that complaints of bad breath. That's another cause for halitosis. Gastrointestinal tract as the third cause. Following pathologies might be rarely responsible for less than 1% of oral malodor, but it is one of the things. One is Sanker's diverticulum, that is a hernia in the esophageal wall, allowing accumulation of the food and debris and putrefaction. അതായത് നമ്മുടെ ലാർജ് ഇൻസ്റ്റൻസ് സ്മോൾ ഇൻസ്റ്റൻസ് കർവിൽ നിൽക്കും. ഒരു ഭാഗത്ത് Sanker's diverticulum, അതൊരു ഹെർണിയ ആ ഈസോഫാഗൽ വാളിലുണ്ടാകുമ്പോൾ ഗെറ്റ് അക്യുമുലേറ്റഡ്, അവിടെ തടഞ്ഞടഞ്ഞ് നിൽക്കുമ്പോൾ putrefaction start causes halitosis, because the bad smell, mainly from the intolerance scatolovolatiles of compounds, comes out through the oral cavity. Gastric hernia can cause reflux of the gastric contents up to the oropharynx. Gastric hernia also causes a reflux of the gastric contents. And one of the reasons is that regurgitation esophagitis, because the regurgitation means it comes out. And the intestinal gas production, some gases such as dimethyl sulfate are absorbed but not metabolized in the intestinal endothelium and thus transported by the blood, and these gases are exhaled through the lungs. ഇപ്പോൾ ഒരു എക്സാമ്പിൾ പറയുകയാണെങ്കിൽ നമ്മളിപ്പോൾ ആൽക്കഹോൾ അല്ലെങ്കിൽ കള്ള് കുടിക്കും ടോടി കുടിച്ചൊരാളുടെ മരുന്ന് എല്ലായിടത്തും this smell comes, bad smell comes. But because it is absorbed but not metabolized by the intestinal endothelium, and thus it transported by the blood, and these gases exhale through the lungs. Complaints of bad breath. Third cause is the cirrhosis of liver. Cirrhosis of liver, ammonium will accumulate in the blood and will be exhaled, because cirrhosis main liver ammonium accumulate in the air exhale will be the ammonic breath or something. That's what it's called as. And fourth reason is kidney. Chronic glomerulonephritis leads to an increased uric acid level in the blood, which is expressed in the expired air with a typical ammonia-like breath. Kidney problem increased uric acid level in the blood, and other expressed air like ammonium-like breath. And systemic metabolic disorder, that is mainly type 1 and type 2 diabetes mellitus. And mainly type 1 diabetes causes accumulation of ketones. So the patient will be having bad breath, and you can diagnose it easily because it's a ketone breath or acetone breath and things like that. And fifth cause is trimethylamine. Trimethylamine is an enzymatic defect that prevents the transformation of trimethylamine to trimethylamine oxide, resulting in abnormal amounts of this molecule. This leads to a typical fishy odor of the breath, urine, sweat, or expressed air. It's an enzymatic defect. It's an enzymatic defect prevents a transformation of the trimethylamine urine. And seventh is a hormonal causes. Increased progesterone level during menstrual cycle also causes typical breath odor. Volatile sulfur compounds in the expired air are increased twofold to fourfold about the day of ovulation and in the premenstrual period. The breath during ovulation and menstruation has been described as a housey odor. Health condition, the medication, certain drugs like metronidazole, which can causes breath malodor because it causes a metallic taste. Eucalyptus, which is a melon-like odor. Arsenic, which is a rotten onion type odor. And how you diagnose halitosis? Halitosis is diagnosed mainly from the patient's medical history. Thorough questioning about the patient medical history. Ask about all the relevant pathologies that the patient is suffering from, and you will get the diagnosis from the patient yourself. So listen to the patient, and patient will tell you the diagnosis. Because in the present scenario, we all are in a hurry. You won't have time to listen to your patient and things like that. So when the patient tells something, you have a predetermined diagnosis. That is the main problem now. So you listen to the patient carefully. The patient will be giving you loopholes, and listen to the patient, and they will tell you the diagnosis. Ask about the frequency, the time of appearance, എപ്പോഴാണ് ഉണ്ടാവുന്നത്, വെതർ ആരെങ്കിലും പറഞ്ഞിട്ടുണ്ടോ നിങ്ങളുടെ അടുത്ത്, ഏതെങ്കിലും മെഡിക്കേഷൻസ് നിങ്ങൾ കഴിക്കുന്നുണ്ടോ, വേറെ ഡ്രൈനെസ് ഓഫ് ദ മൗത്ത് ഉണ്ടോ, അങ്ങനെ എന്തെങ്കിലും സിംറ്റംസ് ഉണ്ടെങ്കിൽ പേഷ്യൻ്റ് ഇത് വ്യക്തമായിട്ട് ചോദിച്ചു മനസ്സിലാക്കുക. സോ ചോദിച്ചു മനസ്സിലാക്കി കഴിഞ്ഞാൽ മോസ്റ്റ്ലി ദേ വിൽ give you the answer and you will be able to diagnose it very easily. Proper diagnostic approach to a malodor patient starts with a thorough questioning about the medical history. One is self-examination. Following self-testing can be used. Smelling a metallic or non-odorous plastic spoon or wooden after scraping the back of the tongue. Swelling a toothpick after introducing it in the interdental area. Licking the wrist and allowing it to dry. Self-examination and smelling saliva, spit in a small cup. Earlier I told you. Or a spoon, especially when allowed to dry for a few seconds, the purification odor can escape from the liquid. And these are measured by the organoleptic measurement. Organoleptic scores. Organoleptic എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ നമ്മൾ നമ്മുടെ ഒരു ഓർഗൻ വെച്ചിട്ട് മണക്കണം. അതായത് ഇപ്പൊ പറഞ്ഞ മാതിരി ഒരു കപ്പില് പേസ്റ്റ് സ്പിറ്റ് ചെയ്ത് അത് ഡ്രൈ ചെയ്ത് മണത്ത് നോക്കുമ്പോൾ ഡിപ്പെൻഡിങ് ഓൺ ദ സിവിയറിറ്റി യു ഗിവ് എ സ്കോർ. So organoleptic scores are the use of one's nose to smell and rank the intensity of the odors emanating from the mouth is the gold standard for the measurement for oral malodor. Even the examiner should test their capacity to smell and recognize different odors, that is a qualitative assessment, as well as their capacity to detect odors at lower concentration, that is quantitative. So examiner should have good capacity to smell and recognize these problems. And these organoleptic scores are measured in a scale of 1 to 5. 0 means no appreciable odor. 1 is barely noticeable odor, described by Rosenberg and McCullough. And 2 is slightly but noticeable odor. 3 is moderate odor. 4 is strong, offensive odor, extremely foul odor. So these are the 5 scoring criteria of organoleptic scores. And before the organoleptic score measurement, you should have advised both patients and examiners must follow some instructions that you should not use any fragrance or shampoo or body lotion or smoking or consumption of alcohol, garlic are prohibited 12 hours before doing the organoleptic assessment. This applies to both dentist and to the patient. And the patient should abstain from using oral rinse and breath fresheners also, because other ഡയഗ്നോസിസിനെ തെറ്റായി ബാധിക്കാൻ സാധ്യതയുള്ള കാരണം അതൊന്നും ഉപയോഗിക്കാൻ പാടില്ല എന്ന് പേഷ്യന്റ് ക്ലിയർ ആയിട്ട് പറയണം. And the judge who smells a series of different types of air samples. One is oral cavity odor. The subject opens the mouth and refrains from breathing while the judge places his or her nose close to the mouth opening and smells air while the patient counts from 1 to 20. Patient നമ്മൾ വർത്താനം പറയുമ്പോൾ പേഷ്യന്റ് 1 to 20 എണ്ണം പറയുക. ആ സമയത്ത് നിങ്ങൾ മെഷർ ചെയ്യേണ്ടതാണ് ഓറൽ കാവിറ്റി. Breath malodor, the subject expires through the mouth while the judge smells both at beginning and at the end of expiration. തുടക്കത്തിലും അവസാനത്തിലും ജഡ്ജ് സ്മെൽ ചെയ്യാണ്. Third is tongue coating. The judge smells the tongue scraping by using a wooden tongue scraping or your tongue cleaner or things like that. Let it dry and smell it. Nasal breath order. The subject expires through the nose, keeping the mouth closed. When the nasal expiration is malodorous, whereas the air expired through the mouth is not, a nasal or paranasal cause can be suspected. എന്തെങ്കിലും ഒരു nasal infection അല്ലെങ്കിൽ nasal tumor or carcinoma എന്തെങ്കിലും ഉണ്ടെന്നുള്ളത് you should suspect. Then is a specific character of breath malodor, because each disease associated with malodor, each disease have a particular smell. So you'll be able to diagnose it the other way also. The smell of rotten eggs is indicative of volatile sulfur compounds. And if any sweet odor has been seen, it has been associated with liver insufficiency. The smell of rotten apples has been associated, it is associated with unbalanced insulin-dependent diabetes, which leads to the accumulation of ketones. Fish odor, it can suggest kidney insufficiency characterized by uremia and accumulation of dimethylamine and trimethyl urine. And ഈ സ്മെല്ലെല്ലാം മെഷർ ചെയ്യാനുള്ള ഒരു മീറ്റർ ആണ്. It's a portable volatile sulfate compound meter monitor called as halimeter. It's a portable electronic device which analyzes the concentration of hydrogen sulfide and methyl mercaptan without discriminating them. ഏതാണ് കൂടുതൽ ഏതാണെന്ന് അറിയില്ല. ഈ രണ്ട് കെമിക്കൽ ഉണ്ടെങ്കിൽ അതിൽ റീഡ് ചെയ്യാൻ പറ്റും. The examination should preferably be done after at least 4 hours of fasting and keeping the mouth closed for 3 minutes. Patient എടുത്ത് യാതൊന്നും കഴിക്കാൻ പാടില്ല എന്ന് പറയാം. So it will be easy for you to detect this. The mouth air is aspirated by inserting a drinking straw fixed on the flexible tube of the instrument. നമ്മുടെ വായിലൊരു ട്യൂബ് വെച്ചിട്ട് നമ്മൾ സ്ട്രോ പിടിക്കുന്ന മാതിരി സ്ട്രോ വെച്ചിട്ട് the flexible end of the instrument. ആ പടത്തിൽ നോക്കി നിങ്ങൾക്ക് കാണാം. The straw is kept about 2 centimeters behind the lips without touching any, നമ്മൾ കൈൻ്റെ ഉള്ളിൽ വെച്ച് without touching any surface, while the subject keeps the mouth slightly open and breathes normally. ബ്രീത്ത് എടുക്കുന്നു, പുറത്തേക്ക് വിടുന്നു. ആ ഇത് സ്മെൽ ഉണ്ടോ എന്ന് ചെക്ക് ചെയ്യാൻ വേണ്ടിയിട്ടാണ് ഹാലിമീറ്റർ യൂസ്. The sulfide meter uses a voltammetric sensor that generates a signal when exposed to sulfur containing gases, especially hydrogen sulfide. Hydrogen sulfide ആണ് മെയിൻലി ഇത് ഡിറ്റക്ട് ചെയ്യുക. Absence of breath malodor leads to readings of 100 pounds per billion or lower. The absence of breath malodor leads to reading of 100 pounds per billion or lower. The patients with elevated concentrated meaning readings are 300 to 400 parts per billion. This has high sensitivity issue for hydrogen sulfide, but low sensitivity for methyl mercaptan, which is a significant contributor of halitosis caused by collagen. And the highly sensitive hydrogen sulfide, but low sensitivity for methyl mercaptan. That is one problem with the halimeter, which is a significant caused by the periodontal disease. And next method is gas chromatography. This device can analyze air that's incubated in saliva or clavicular fluid for any volatile compound. The elaborate gas chromatography is especially useful for identifying non-oral causes. Non-oral causes are easily കണ്ടുപിടിക്കാൻ എളുപ്പം. Small portable gas chromatograph can be used in periodontal clinics, which has the capacity to measure the concentration of mainly 3 key sulfides. Earlier നമ്മൾ പറഞ്ഞു volatile sulfur compounds, hydrogen sulfide, methyl mercaptan. ഇത് മെഷർ ചെയ്യാൻ ഏറ്റവും എളുപ്പമുള്ളതാണ്. പക്ഷെ ഇറ്റ്സ് വെരി എക്സ്പെൻസീവ്. ഒരു ക്ലിനിക്കിൽ വെക്കുക എന്നുള്ളത് ഇറ്റ്സ് വെരി expensive. Portable monitor ആണ്. Small amount of blood sample is aspirated with a plastic syringe, is injected into the input port of the gas chromatograph, and the computer displays the detection and amount of 3 important volatile sulfur compounds in parts per billion within 8 minutes. 8 minutes report varum, but the machine, everything is bit expensive. And other method is നമ്മൾ പറഞ്ഞ മാതിരിയാണ് ഇത് പല കെമിക്കൽ മെത്തേഡ്സ് ഉണ്ട് സൈക്കോ കെമിക്കൽ മെത്തേഡ് ഓർ ബൈ physiological method. This is psychochemical method, dark field or phase contrast microscopy. Gingivitis and periodontitis are associated with high incidence of motile organisms and spirochetes. Shift in these proportions allow monitoring of therapeutic progress. Another advantage is that patient becomes aware of bacterial present in plaque, tongue coating, and saliva. High proportion of spirochetes in plaque causes specific acidic malodor. And other thing is that saliva incubation test, that is 0.5 ml of unstimulated saliva is collected in a glass tube and the tube is flushed with carbon dioxide and sealed. Sealing is to prevent the inflow from the air from outside and the glass prevents the smell of the hardware. It is incubated at 37 degrees centigrade in an anaerobic chamber under an atmosphere of 80% nitrogen, 10% carbon dioxide, 100%, 10% hydrogen over 3 hours. And then the organoleptic measurement is taken. The organoleptic ratings highly correlate with volatile sulfur compounds and organoleptic rating of the patient. Other one is the Banner test, which you use for many other conditions also. 3 bacteria associated with periodontal disease, mainly Treponema denticola, Porphyromonas gingivalis, and Tannarella forsythia, produce both volatile sulfur compounds and volatile fatty acids such as butyrate and propionate. Their detection in plaque and tongue samples might provide additional information concerning factors contributing to the individual's malodor. The BANA means it's a benzoyl D-L-arginine alpha naphthalamide, that is a BANA, is a synthetic trypsin substrate forming a colored compound. The chair said as a maximum of 5 to 10 minutes can be done with the help of BANA test, detect presence of enzymes in the plaque and tongue samples. I sample that machine, so it gives a report. And the latest one is the electronic nose, which is under, again, studies are going on, like electronic nose to detect malodor. So it reads in a computer. When you're going for the treatment of oral malodor, the treatment of oral malodor should preferably be cause related. എന്താണ് cause? അതിനെ നമ്മൾ കണ്ടുപിടിച്ചിട്ട് diagnose ചെയ്ത് treat ചെയ്താലാണ് the malodor can be eliminated. The treatment of extraoral pathologic halitosis and halitophobia should be undertaken by a medical specialist or psychologist. കാരണം നമുക്ക് oral cause നമുക്ക് പറ്റും as a dentist, but because of the other extraoral pathology causes, it can be treated by a medical specialist, and even halitophobia that has to be treated by a psychologist. Sometimes the patient requires counseling and things like that. The best way to treat oral malodor is to motivate the patients to practice good oral hygiene and home care. Toothbrushing accompanied by tongue cleaning results in substantial reduction in volatile sulfur compounds and morning breath. Antimicrobial mouth rinses also have a beneficial effect on periodontal pathogens producing oral malodor. The following general treatment strategies can be applied. One is mechanical reduction of intraoral nutrients and microorganisms, chemical reduction of oral microbial load, rendering malodorous gas non-volatile, or masking the malodor. ഈ 4 രീതിയിൽ നമുക്ക് ചെയ്യാം. മെക്കാനിക്കൽ റിഡക്ഷൻ, അതായത് നമ്മൾ സ്കെയിലിംഗ് റൂട്ട് പ്ലാനിങ് വാട്ട് നമ്മൾ മെക്കാനിക്കലായിട്ട് റിഡക്ഷൻ ചെയ്യാൻ ശ്രമിക്കുന്നു. കെമിക്കൽ ബൈ യൂസിങ് ഓഫ് മൗത്ത് വാഷ് ആൻഡ് തിങ്സ് ലൈക്ക് ദാറ്റ് നമ്മൾ കുറയ്ക്കാൻ ശ്രമിക്കുന്നു. തേർഡ്, നമ്മൾ ഈ മാലോഡറസ് ഗ്യാസിനെ നോൺ വോളറ്റൈൽ ആക്കാൻ, ഇപ്പോൾ 2 പോസിറ്റീവ് അയോൺസിന് പകരം ഒരു നെഗറ്റീവ് അയോൺസ്, സോ ഇറ്റ് ബിക്കംസ് നെഗറ്റീവ്, ആൻഡ് മാസ്കിംഗ് ദ മാലോഡർ ബൈ യൂസിങ് chewing gums or lozenges and things like that. Mechanical reduction, tongue cleaning reduces both the amount of coating and the number of organisms, thereby reducing oral malodor. Cleaning of the tongue can be carried out with a normal toothbrush, a tongue scraper, cleaning as far as possible. Tongue scraper use ചെയ്യാൻ പാടില്ല. Nowadays only toothbrush should be used. Interdental cleansing with both waxed and unwaxed floss or interdental toothbrush can be used. And in periodontitis, periodontal therapy, one stage full mouth disinfection combining with scaling and root planing with application of chlorhexidine using and reduce organoleptic score up to 90%. If the patient is wearing dentures, advise them to remove denture at bedtime and clean it and soak in dental cleaning solution. And chemical reduction of oral microbial load. The active ingredients oral rinses are mainly chlorhexidine or cetylpyranidine, essential oils, or chlorine dioxide, hydrogen peroxide, and triclosan. But all these agents have only a temporary reducing effect on the oral microorganism. In that, chlorhexidine has a long-lasting capacity. It lasts up to 12 hours in patient's mouth. So it has a good substantivity. So mainly use mouthwash in oral halitosis is chlorhexidine. Because of its strong antibacterial effect, superior substantivity in the oral cavity, chlorhexidine rinsing provides significant reduction in the volatile sulfur compounds. Rinsing with mainly 0.12% of chlorhexidine gluconate in combination with tooth and tongue brushing significantly reduce volatile sulfur compounds and mouth breath. Halitosis is a new solution that is 0.05 chlorhexidine, 0.05 cetylpyranidine chloride, and 0.14% zinc lactate, and no alcohol is more efficient than chlorhexidine alone. Essential oil, which can be used on a regular basis with less side effect, and Listerine is only relatively effective against oral malodor and cause sustained reduction in the levels of odorogenic bacteria. Chlorine dioxide rinses is a powerful oxidizing agent that can eliminate bad breath by oxidation of hydrogen sulfide, methyl mercaptan, and amino acids methionine and cysteine. Triclosan is a broad spectrum antibacterial agent effective against most oral bacteria, containing 50% triclosan and 0.84% zinc, produce a more prolonged reduction in mouth odor. The two-phase oil water rinse, that is the two-phase containing cetylpyranidine chloride, shown to result in a day-long reduction in oral malodor, but it's not available in India. The efficacy of oil water CPC, that cetyl formulation, result from the addition of high proportion of oral microorganisms to the oil droplet, which is further enhanced by the cetylpyranidine. Twice a daily rinse showed reductions in volatile sulfur compounds. Amine or stannous fluoride rinses are effective in reducing oral malodor, but only for few hours. Oxidizing lozenges, sucking a lozenge with the oxidating property reduces the tongue dorsum malodor for approximately 3 hours, and the malodor effect may be caused by the activity of dehydroascorbic acid, which is generated by peroxide mediated oxidation. Rinsing with 3% hydrogen peroxide also shows reduction in sulfur gas that persists up to 8 hours. This conversion of volatile sulfur compounds. The zinc is an ion with two positive charges, which bind to the twicely negative loaded sulfur radical, thus can reduce the expression of volatile sulfur compound. That is, two positive, two negative, it becomes neutral. Halita we discussed earlier, 0.05% chlorhexidine, 0.05 cetylpyranidine, and zinc lactate more efficient than 0.2% in reducing volatile sulfur compounds and organoleptic, which acts by the volatile ability by zinc. And toothpaste we use base ink solid dentifrice are effective with a 44% reduction in volatile sulfur compounds up to 3 hours. And there is a 31% reduction for a fluoride dentifrice. The mechanism by which baking soda produces its inhibition of oral malodor might be related to the bactericidal effect and its transformation of volatile sulfur compounds to non-volatile state. Now, chemical action ions, positive, negative ions. Sodium fluoride containing paste, zinc citrate also show reduction in volatile sulfur compound. Chewing gum, which is available in the market now, contains tea extract, that is epigallocatechin, reduces oral malodor to some extent. The chemical reaction between epigallocatechin results in a non-volatile product. 2 milligrams zinc acetate containing chewing gum also shows reduction, volatiles up to 45%. Masking the malodor by using mouth sprays, lozenges, which has a pleasant but very short-term effect. Another way to mask malodor is to increase the solubility of malodorous compound in saliva by lowering the pH of saliva. Since low pH increases the solubility of volatile sulfur compounds or increases secretion of saliva, because large amount allows the retention of larger volumes of volatile sulfur compound. Other way is to increase the salivary secretion by proper liquid intake or chewing gum or sugarless gum. It neutralizes the acids in the mouth. To lower the pH, in orange juice is sufficient, but all this has a very minimal effect or very short-term effect. And to conclude, bad breath is a major concern for many people because it nearly always originates in the mouth and can be diagnosed and treated professionally. But recent developments in the understanding of the etiologies of malodor have spawned new techniques for the assessment and management. But though you treat the patient will always have the complaint that she is having a bad breath. That's halitophobia is always there in mouth, but it is one of the primary concern in your private practice, or if you're going out. Most of the patients will complain of, I have bad breath when I have this. I have my friends used to complain. My relatives or my partner will complain. So you are the one to diagnose it. If it is an intraoral cause, you diagnose it, treat it properly. Intraoral causes we discussed earlier can be used to because of dental caries, causes foot impaction, it can be used of any app because of any presence of any abscess or sinus, or mainly due to calculus and plaque, gingivitis, periodontitis. All these causes intraoral halitosis, the tongue coatings, the major ones. So all these things, if you treat it, and if for some extent, if it is because of that, it can be corrected. Extraoral causes, as we told earlier, because of mainly ear, nose, throat, upper respiratory tract infection, your lungs, digestive factor, systemic illness like diabetes mellitus, all this. And the chemical, how to treat halitosis. You treat the halitosis by both ways. Yes. Extraoral causes can be treated by a medical specialist or a psychologist. Intraoral cases can be treated by you. And even you can use so many mouthwashes and things like that, but chlorhexidine shows better properties or substantivity in the oral cavity than other mouth rinses. Then so many halita and things like that are there. Even lozenges, all these have very short-term effect. So you got to be very thorough in counseling the patient, motivating the patient to maintain their good oral hygiene. So it depends on you doctors how to go with, how to treat the patient, how to gain confidence in them, how to motivate them, how to you should do a small type of counseling also in treating these patients, because they will be psychologically depressed or things like that. So it's up to you dentist to treat halitosis and to relieve the patient, whether it is a halitophobia or is it psychological or pseudohalitosis or pathological halitosis. It's up to you to diagnose, decide, and treat. Thank you.